So the international health regulations is a commitment made by countries like St. Lucia to be able to develop our capacity to respond to detect and respond to any public health threats. And in doing so, we ensure that these threats do not leave our borders and spread to other countries. And so part of our mandatory obligation, or our obligation, I should say, is that we respond to this assessment. We look internally at what we have in place and we try to respond as accurately as possible. So the state party assessment tool is done annually and it involves bringing together a wide range of stakeholders. So we had gathered persons from health, from the animal sector, the police, from the Attorney General's office. And so these individuals came together to have a discussion. What was important is that discussion, persons being able to bring different things to the table. And so in doing so, we were able to get a more accurate picture of what we have in place, identify our gaps, identify our challenges, and decide on the measures that we can put in place to be able to improve next year. It was really amazing to have the team from the Pan American Health Organization visit so that they can actually see the process that St. Lucia is going through. It is actually recommended that we bring stakeholders in to be able to respond to this annual assessment. And in the past, what we had done is bring together a small cohort of individuals and call in to other persons where we had gaps and challenges, but that did not permit us to have that level of discussion that we had this time. So this was the first year that we brought in so many stakeholders to be able to discuss the IHR State Party Assessment Tool. And it was wonderful to have them see it. It was wonderful to have them be a part of it and offer their encouragement for future stakeholder consultations. So we're definitely looking forward to making it better next year when we respond to the SPA. Surveillance was scored very highly. With the implementation of our event-based surveillance system earlier this year, this was an asset to us. It complements what we already had going on. We did have event-based in an ad hoc manner, so what we did was just strengthen it. So that was a big plus for us. We also scored very well in terms of disaster. We looked at our multi-hazard plan that was recently updated, so that put us high up there as well, and we were very happy with that. And also we looked at our risk communication. A lot of work has been done with risk communication, engaging persons on the ground and developing that tool. And disaster, as I said earlier. So these were the top scoring. However, we have certain challenges in other capacities, as you would imagine, for example, responding to chemical and radiation emergencies. So these are areas that we really have to look within and try to improve for the next assessment. We also have to look at bringing together stakeholders, not once a year, but working a little more intimately with our stakeholders, because as you would imagine, from COVID-19, it wasn't just a Ministry of Health response, it was a national response. And so this is how we are heading, and we're hoping to improve for our next assessment. Well, we're hoping it does not only improve on the Ministry of Health, but with all the stakeholders present, we're hoping that from the discussions that we had, each stakeholder will look within their ministry or department and identify what are the gaps that we highlighted and work on them little by little, gnawing away at them so that we can get to that level 5 that we're aiming for, do a little more of the assessments, simulations. That was one of our challenges as well. So we're hoping for everyone, not just ministry, but for everyone to look at where we scored and the areas where the different ministries can work together and collaborate and improve on our scores.